after we have all of our speakers present. So start thinking about those. But for now, we will go to Julie Pride from CUPHD. She'll open it up for us.
Hi, good afternoon, everyone. In the past week, we have reported over
Hi, Julie. Sorry, we lost your sound there.
Sorry. Good afternoon, everyone. In the past week, we have the CUPHD has reported over 700 cases. We're getting anywhere between 100 and 150 cases every day, and they are continuing to rise. Champaign County alone right now has a positivity rate over 8%, and you can see how quickly that has jumped up. That's exponential growth, and we're kind of getting into the explosion of cases phase. Our region 6 positivity, region 6 positivity rate is over 12% right now and also continues to rise. It's likely that our region will be put into tier 2 mitigation next week. The spread we are seeing is widespread community transmission. That is what it's considered. This is not cases coming from the U of I. These are cases transmitting within our community. Champaign County right now has a record since this pandemic began. We have a record number of hospitalizations, and in the past week alone, we've reported 8 deaths. There's no sign right now of this slowing down. And in addition to this, we're starting to see flu in our ERs and our convenient cares. We're seeing most of this COVID spread right now. It's being caused by gatherings. These are including formal gatherings such as parties, weddings, receptions, funerals, dinner parties, birthday parties, meetings, and informal gatherings such as just friends and family getting together. We're also seeing spread coming from bars and restaurants that are not following tier 1 outdoor seating only guidance. It is a little difficult to tease that out in the sense that bars and restaurants are reported together on that. So starting today, CUPHD is recommending the following mitigation steps to try to get these cases down and to try to get our county back to some semblance of normalcy. Number 1, we are recommending today, and we've already sent it out to the school, that all schools switch to remote learning through January. We're recommending that faith-based organizations go to remote services only. We are recommending that bars and restaurants start following guidance, the ones who aren't, and a lot of them are, and having no indoor service. And we are strongly urging people to reconsider gathering for the holidays, specifically Thanksgiving coming up in a couple of weeks, and only gather with your household members. People need to stay home as much as possible and go out only if necessary. Avoid travel and not have gatherings, even those with close family and friends outside of your household. I cannot stress how much we're seeing this.
Tomorrow or the end of the week to finish things up, but who knows?
Alison, I don't know who you are, but your phone's on. Okay, do not have gatherings, even with close family or friends outside of your own household. Again, we are seeing a lot of people who have been, gathering with, whether it's their parents or grandparents, other family and friends. And then tragically, we're seeing a lot of spread that way. Just because it has been okay to do it throughout the beginning part of the pandemic, we are seeing now lots and lots of spread that way. We're urging people, like I said, not to gather with others outside of your own household at Thanksgiving. If you're going to do that, despite our guidance, we suggest that you assume everyone that you're at that gathering is infectious, including yourself, and treat it as such. If possible, gather outside. If you have to be inside, keep your windows open with air circulation by placing fans pointing outwards, and wear masks and distance at all times when you're not eating and drinking. We have additional guidance on our website for that. And I do want to stress, because I am so upset that the recommendation is to have schools go to remote learning, because I do want to be clear that the schools in our county are doing an amazing job. They're doing a great job with, you know, the control guidance that we've put in. But with this much uncontrollable spread, you'll notice on the guidance that came down from, you know, ISB and IDPH, that once we get to a certain level of positivity, that this is the recommended steps to take. So it's basically, you can't have everything. So if people are going to continue to gather and have weddings and have receptions and act like we're not in a pandemic, then, you know, schools are going to suffer and other places are going to suffer. We have to get this, we have got to get this level of transmission down and get it down soon, because we do not want to see what's happening in other places in our state and in other places in the country. So again, I wish I had better news, but this is where we are right now. So thank you.
Thank you, Julie. And just a reminder, if we could, again, there's a ton of people in this room right now. So if you could mute your phones, we'd really appreciate that. We are getting some cross audio here, so try to avoid that. Our next speaker is going to be Champaign Mayor Deb Finan.
Hello, thank you all for being here with us today. The next 2 months could really be the most devastating period to date for COVID. I guess the good news is it looks like vaccines are not too far away, but they're not going to stop this surge. It is time right now to work against COVID. We absolutely have COVID fatigue in this community, and we have to fight against that. We have to deploy everything we have to prevent this disease from taking more lives. We also need to help our economy stay open. And the way to do that is to continue to social distance, wear a mask, wash your hands, follow the guidelines that Julie Pride has suggested and that CUPHD is suggesting. It is our continued compliance and diligence that will allow us to move out of mitigation and for our economy to remain open. We're asking for all of you to help. We have a community that has pitched in and done what we've needed to do. We had a summer with relatively low cases, and we know that you all have the ability to do it. Please, please take seriously the recommendations relating to the holidays. No one wants to spend the holidays the way that we have to during COVID, but you need to really create new opportunities for your family, find new ways to celebrate, be creative, and know that the work you're doing now will mean that your loved ones and your friends will be there to join you next year when we're not in the middle of this pandemic. Thank you.
Thank you, Mayor. Next, we have Urbana Mayor Diane Marlin. And Mayor, you are on mute, I think.
I won't repeat everything that's been said, but I will add this. And I had dreaded the words sustained community spread. And I heard those this morning, and I've heard them for the last week. And that is, it's a day that I hoped would never come to our community, but it has, which means this virus is everywhere, and it will begin to affect city services. It's already, we have positive cases among employees. We have employees who've been exposed through a family member or friend. The end result is the same. They're either isolated, they're quarantined, they're at home. And so many municipal employees are ones that cannot work from home. Half our staff are police or firefighters. They can't do their jobs from home. If they're quarantined, they're out of service. Public Works, the people who plow the streets, who replace the light bulbs, who respond to calls for service, who fix the sewer pipes, they have to be on the job. And if they're sidelined, that service is going to be delayed. It may not get done. It won't get done on time. And the same goes for all of our city employees. We've done the best we can to keep our workplace safe, but with sustained community spread, the virus is everywhere. And that's an impact of this pandemic that the community, really hasn't felt and won't feel until now. And if you need any other reason to adhere to the guidelines, to stay home, to avoid the gatherings, to wear a mask, to stay distanced, it's to help us maintain the services that your lives depend on. So we're asking again for people to think of the larger community and think of the impact, and the sacrifices we make today will allow your cities and county government and municipalities to keep functioning, for you to get the services that you need. We're all tired, we're all exhausted, but we're not through this, and we're entering the worst period. So we need the community's help, and that includes the entire county. Thank you.
Thank you, Mayor. Excuse me. Our next speaker is Champaign County Executive Darlene Kleppel.
And I just want to add my words to this as well. Thank you, mayors, for your words as well. I think we're all in this together. This is a county-wide effort. We've been really good in our county about keeping our numbers down, but that is changing. We are going up along with everyone else. And it's because of the community spread and even the small things that we're doing that we thought, well, maybe we could try this, or maybe we could, continue this. Those aren't working anymore. We need to have a better strategy for the time being. So the other thing I just want to add to what Diane was saying is, if the fact that county services are at risk, or the city services are at risk because people are out, I just want people to be aware that it has already cost all of the jurisdictions in the county several hundreds of thousands of dollars to pay for time for people to be off because they have to be at home, they have to be quarantined, and they're not able to provide their jobs, but it's also costing money to do that. So there's a huge cost to this that maybe isn't obvious to people that aren't involved with those kind of things. So I just want to add my plea to everyone in the county to please wear your masks, to please keep home if you can do that. I know there are many things that have to be occurring. We do have a lot of essential things that have to be happening for legal requirements or for safety requirements. But if there's any way to stay at home, please do that. And I just add my plea to that. We need to get through the next few weeks because this is really rising at a fast rate. Thank you.
Thank you. And so this brings us to the point in our news briefing where we'll take a few questions. I think what we'll have to do, since we have so many participants, is limit it to one question per person, at least on the first go around. But if you want to put those, go ahead and put those in the chat. I don't see any yet. So I suspect there are some questions out there, but I'll wait a few seconds here to see if any come through. Okay, so the first question I see is, does the recommendation to move to remote learning apply to the University of Illinois as well?
No, this is K through 12. The U of I is already doing a lot of remote learning. And this is community spread that we're seeing right now.
Okay, thank you, Julie. So we'll wait a few seconds for another question. This question, I think for you again, Julie, how soon will schools need to start going remote?
We don't have a specific time, as soon as possible, but the thing is, we can't say that. I mean, this is our recommendation, but schools have a lot of stuff that they need to, deal with that's out, we don't even know. So we're just saying as soon as they can. So I know that some of them have, they've got to contact parents and give parents time, and they've got to, some kids are going to have to get computers and stuff like that. So we're just saying as soon as they can do that.
And does this affect K through 5 after school programs or care programs for children of those ages? think we're standing by for an answer on that
Okay,
one.
sorry about that. I had to check with Awais on that, but usually the after school programs, when they're doing remote learning, is for essential employees only. So if the parents have to work, then that would still be okay.
Okay, the next question I see here, it was mentioned that schools remain full remote through the end of January or January 5th recommendation. I'm not sure what the question is there. I'll go to this one for Darlene Kleppel. So we're hearing instances of non-compliance that are happening increasingly in the county outside of CU. What is being done in the county to address violations of the mitigation orders?
So everything that the public health department is distributing with regard to mitigation, I'm distributing on to all of the small communities that are in our county, the mayors and other people, and they're receiving that information. The county itself actually has jurisdiction for example, liquor licenses, things like that, in only the areas that are outside of incorporated city limits. So if you're in a smaller town, you might have your own laws and your mayor handles those things. So it's a little more complicated because every jurisdiction has their own mayors, but I am reaching out, trying to get compliance from places that are in the county in the unincorporated areas. I've been out with public health to visit a couple of places and say, please tamp down your activities a little bit. And I will continue to do that.
Okay, thank you. This one's for Mayor Finan. Several Champaign restaurants are taking down their tests because they will have exceeded the 6-month allowance of having their tent out. Taking down their tents. Will you be issuing further guidance when it comes to tents during the pandemic and current mitigations?
I think that we already have, actually. So there was an order entered this week relating to some additional, not only for, I think, tents, but also we have some creative kind of using awnings and things like that. But we certainly are willing to work with the restaurants. We are not, I don't believe we're requiring them to take them down after this 6 months. I think there were some that were taking them down because it was cold out and they had to have 2 or 3 sides open in order to comply. But I don't think they were taking them down related to any city requirement.
Thank you. I think this one goes back to Julie. Any thoughts on when school would be able to reopen?
We're asking that they go to remote learning through January 5th. I had said earlier, I said through January, but until the next semester begins.
Okay, thank you. And would there be a recommended classroom enrollment for care programs for essential workers?
Yes. Yeah, some of this stuff, I assume that's coming from a school. We're probably going to need to have a call here with the schools to go over some of this stuff. But we have all that guidance now. We can resend all that back out.
Okay, thank you. And here's a question. Transmission in schools has been minimal, so is it not safer for children to be in schools, considering for many parents, other forms of daycare will be their only viable option?
Well, I don't know. I mean, honestly, I don't know. I know that the K through 12 guidance for community transmission, when it gets up to a certain point, is to go to remote learning. That is above our heads where that came from, but we can certainly, even though our schools are doing a good job, once you get this much community transmission, you're going to start seeing a lot of faculty and staff and kids with it as well. So I don't know what's going to happen with daycares. We have seen daycares right now that have actually had to close because they had so many people out with it right now. So it's just not a good time at all to be gathered in any way, but.
Okay. The next one I see here is, are you considering implementing the same weekly testing system used at U of I in other communities of the county.
So you mean deploying that technology? That's up to the U of I when they get their FDA approval. And I think that they are probably going to look at sending that out to other places. This is different, what we're seeing right now. This is just very high rates of community transmission. We are not having an issue with testing in our community. We have more testing than anyone. And to have our test positivity rate up as high as it is with as much testing we do is really concerning.
Well, I would jump in. We do have an issue with testing, and that the test results for those who go to places like Marketplace for testing are taking much longer to come back to people. And if we can't get them back 24 to 48 hours, and there are people, and I know people who've been waiting 4 or 5 days, and now they're being notified by email rather than a phone call. And that's related to where, the processing times now, but that is now an issue for us to be able to rely on Marketplace, for example, to have our employees go test. It just takes too long.
Yeah, it is. And we're rolling out some of the Binax testing, it's called, to certain places that can do it that want to test, employees and everything. So we have options with that, but the test positivity rate is too high. With all the testing that we do have. And yes, the slow Marketplace results is caused by the lab being overwhelmed. And that is not good because once it's 48 hours, past 48 hours, it becomes much, much less effective for public health to be able to shut down any type of spread. And the cases are just going up. So it's just more and more and more.
Okay, I think that concludes our questions from news media. I see we're coming up against our time here, but if anyone has a last-minute question for any of our speakers, I'll give it about a 10 or 15-second countdown. Otherwise, we will conclude the news briefing for today.
Patrick, I'd just like to make a comment at the end here. I think that people who have known someone with COVID might have had someone that had not a very serious case, or they might not even have known they were symptomatic. And I think we're starting to see that that's really not the case for a lot of people, not only people with underlying conditions, but regular people just getting it. And if you have some of those experiences starting to appear, you're going to hear more about what a serious disease this is when people get it. And I think that might, hopefully, if you hear some of that, or before you hear that, you might realize that spreading it is not a good idea, even though it doesn't seem like somebody you knew had it very badly. So I want to mention that as well.
Yeah, and that is a good point. We're seeing, record number of hospitalizations, and we're seeing, more deaths, and we're seeing a lot of people seriously ill. And there's a lot of people that are younger that are having what's called long hauler syndrome as well, where they're not bouncing back from this. So this is, and again, we also, we've got to get through this, and we've got to wait until we can get the vaccine available to us. But we've got to still get through winter for that, because there's no way that we're going to have that in any significant amount to do community clinics until probably summer. So we've got to double down right now, especially because we're getting into the explosive growth stage, and that is very scary.
Okay, thank you very much. Thank you to our speakers today, and also to not only to the news media who are here, but all the members of our community who have joined as well. I know this is not a perfect system for doing these types of news briefings, but it truly is the safest way to do them. So we thank you for bearing with us, and thank you for keeping our community informed. So I will conclude the session for today. Thank you all very much. One last note, I have been recording this, so if you're having technical issues or anything like that, send me an email, pwade@illinois.edu, and I can get you a copy of that. Thank you.